Okay, you're recording. You want to say hi?
Hi.
And you had your first surgery with us in Michigan 2 years ago.
Mm-hmm.
And your starting weight was 235. And you had the maximum loss down to 160.
160. Right.
And then you bounced back up to
183.
To 183, which is unfortunate complication because we wanted you to lose more.
Right.
And so we reoperated, and I'll volunteer to say what we found in her surgery is your stomach was left too big by us. So your stomach pouch was bigger than we wanted. So we trimmed that, kind of trimmed it narrow, and we found your bypass was about 4 or 5 feet.
Right.
So we added to the bypass about 6 feet.
Mm-hmm.
And that you did great the morning after surgery, but then something happened.
Yeah, the day after when I went home, I couldn't keep anything down.
Right. Trouble swallowing.
Trouble swallowing. Well, I would swallow okay, but would come right back up.
Right.
So it was.
Right. Jennifer, do you know about that?
Yeah.
Can I get an amen? So in other words, when Dr. Rutledge sews all this area up, what we want is a perfect connection that's just the right diameter that will let yogurt and crackers through. And we want it kind of tight, but we don't want it too tight. But when you stitch and sew on abdominal tissue, it can swell and be too tight. And if it's too tight, our hopes and prayers is that it's just some swelling, it'll go away after a day or two of medicines. And you came into the ER after me kind of requesting, encouraging, suggesting.
Telling me, go to the ER.
And you're saying, can't I just take some medicine?
Yeah, right.
Right. So you went to the ER, and they wanted to give you IV fluid.
Right.
You declined.
Right.
Because she's got a good, strong willpower.
I said, I'm drinking just fine. I'm just coming back up, that's all.
And they gave you some Reglan.
Yep, they gave me a shot.
Gave you a shot, and you felt a little bit better.
Mm-hmm.
And kind of made it through.
Mm-hmm.
Other than a 4 or 5 hour visit in the ER.
Other than that, yeah. That was just a little small glitch in the healing process.
And you're very kind to be so nice about it, but in other words, that's a complication. For those of you who are thinking of having surgery, that is a complication that can happen. We apologize if that happens, but if it happens, usually some medicine or some IV fluids or occasionally an extra day or two in the hospital should get that better.
He looked for me in the hospital the next day. I wasn't there.
I was a little nervous for a while. I said, "Where's Miss Berger?" And they said,
I had casinos to go to.
Well, the answer was she didn't make it. I'm going, what? Oh, she didn't make it into the hospital. I'm going, okay, right. You scared me for a second.
There's things to do and places to go.
Have you weighed yourself?
No, I haven't.
Okay.
I haven't had a scale around.
Okay.
But I can feel the difference already. I can feel my clothes are looser and stuff is feeling better at me now. I'm not like...
May we take your staples out?
Sure. The only thing that I am feeling, I just wanted to get a question, when I'm like walking too fast, I feel like I can't expand my breathing,
Yeah.
enough. I'm feeling like it's tight still in there.
Like a corset maybe, or you pulled your shoelaces too tight?
Yeah, like it's won't open. That's you. You did that to me.
Guilty,
Okay.
yeah. In other words, that's exactly what we did. That feeling of tightness is where we took and stapled and trimmed the stomach, and then we took a suture, a running suture, just like you pull up the laces on your shoe, and we went and pulled it up tight. And so that's that tight feeling is exactly right. That's what we did to your new stomach.
All right. Now, that's going to get a little looser, or will
Little
that
bit.
stay that tight?
Well, it's going to be snug in there. So when you eat now, does it feel different? Well, it has to feel a little bit different. Remember, you came to the ER because it wouldn't even go down.
Well, yeah. I mean, from that, but I mean,
Right.
from my previous surgery, no. I'm back to where the good part, where I'm feeling full again.
Okay.
Where afterwards, my last surgery, it started getting less and less and less. That I got that really full feeling after eating only a little bit.
Right.
I lost that. Now I've gotten that back, and I like that a lot.
Yeah,
That's
that
a
feeling
really good thing.
of kind of restriction. It's again, if you think of putting on a tight shoe, you don't want it too tight.
No.
That way you can't swallow if we make it too tight. So our goal was to snug it up and give you that support, just like if you have a shoe that's on just right, you pull up the laces tight, but you don't want it too tight. And that's what we were hoping to do. And it's an imperfect process, but it sounds like we got it about right. So that feeling of kind of snugness or restriction, or like you have a corset on too tight kind of thing, that's intentional. That's me.
Okay. And will it get better though? Because I mean, like if I try to walk too fast and I
Yes.
try to breathe too deep,
Yeah. Well,
all
we
of a
wanted
sudden
to,
it stops me.
yeah, again, what we wanted in your case is we wanted to do perfect. And we're not perfect, but we
Just
try, right, we try for perfection. And the idea there is we want to make the new stomach small, but not too small. And we're always striving to bypass enough, but not too much and not too little. And so our hopes and prayers are that we did just right. And we have a pretty good track record, but it's not perfect. So there is a risk that it'll be too tight. But I think that we got a good closure on your stomach, and I think it's about the right size, and I felt real good about it.
Okay.
And if you look at Sandy and Trish, they both had the same kind of revision, and they both done real well with that. So our hopes are
Yeah, they look great.
Yeah, we want you to be as successful as Sandy and Trish.
Yes, we would like that. That'd be very good.
Yeah, yeah. Should we take your staples?
Sure.
All right. Do you have your staple remover?
I do,
All right. Good. Thank you. Is it okay if we do it on camera?
Yeah.
All right. Thank you.
but I do have I got
Little
a bruise.
Okay. Again, that's my fault.
That's where he beat me up.
I said, this Michigan patient, I'll teach her to come.
Yeah, right. Once they come back, they get you.
That's right. So for those of you who haven't had surgery, you can have a little bit of bruising. Where this bruise is actually right over a major blood vessel. The blood vessel's name is the mid-epigastric artery and vein. And so you can get some bruising. It's not a bad thing.
Looks like a big difference.
It's right.
It's a clock. I was thinking of putting 3, 6, 9, and 12, on here, and putting some hands on there.
Okay, applause. Thank you. Yes?